Thank you. Any comments from Finance or LAO?
Chris Cook, Department of Finance. No further comments, but happy to answer any questions you have.
Okay, sounds good.
Madam Chair, speaking of fresh, this is so refreshing. No, I mean, we have been through so many years of figuring out how to minimize the damage, you know, and just taking another step back in terms of really helping the people of the state. And your enthusiasm is quite infectious. It's nice to have somebody who's really, really involved and enthusiastic about what they're doing, but also the content here in terms of the idea that we're really trying to, the way you've described it, really moving forward in terms of addressing all of the needs of individuals and families. So very enjoyable to listen to you.
Yes.
I may have missed it in your presentation, but at this stage, what you have achieved horizontal integration on is CalFresh and Medi-Cal?
That has been our primary focus.
So, I mean, it doesn't extend to CalWorks.
So there is the referral page through the CalHears. There is CalWorks referral through that process as well.
And they're part of our single application as well.
Well, I mean, you know, I got excited a few years ago because we were talking about one e-app, and that seemed to have sort of drifted away somewhere in the maybe it got lost in the fact that nobody had any money. I don't know. But is that I was going to ask you, what's the manifestation of this at the functional level when somebody walks in the Human Assistance Office on 28th Street in Sacramento and says, I'm not doing so well, maybe I qualify for something, can you help me, to the eligibility worker? Does anything happen in that setting?
Yeah, I mean, it simplified the process. I mean, you can talk better about the SAWS 2 Plus.
Well, they basically, it's one document, and it has integrated all the questions. So while you're doing the interview, you're getting all the information for CalWorks, CalFresh, health coverage, Medi-Cal, any potential thing. And you also at the end ask, do you need referrals to WIC? Do you need this? And it's one application, one signature, and you're out the door, and there are no more forms.
Okay.
So that is what we're
gotten that
yes,
part.
and it's automated. Typically, there's people that do it online now, and they could do it with a telephonic interview and a signature without having to come in, which is good for working poor. We've also, you know, people can do it on the phone call. They can also do an interactive interview with so they're entering the information for them. It's not all paper apps and filling out tons of pages. So we've tried to make the experience a lot more comprehensive in what you get, but a lot more streamlined.
Okay, and does it apply? Is it deployed in all counties or only the SAWS?
Question,
all counties.
All counties.
Now.
All counties now. Ever since January 1st with ACA, we've been, and it's in 17 languages too. So there you go. We're out there.
And then where I know you talked a little bit about Covered California. So is that a referral at this point, or is that integrated into the application? Where's that stand?
So it's a referral from Covered California. So when they finish their single streamlined application required from the feds, then it switches over and allows them, it gives them brief information about CalFresh and CalWorks, says, are you interested in a referral? If they say yes, that gets sent to their county of residence, who follows up to finish the process with them. And that's one of the next steps that we're working on, is saying, how do we streamline that process so it's not a follow-up, but rather when they say, yes, I'm interested, they're taken immediately to complete that application for that program.
So it's not that their eligibility information on the application is transferred when they say, yes, I'm interested. It's that they have a referral to the program, and then they have to follow. How does that work?
Yeah, they have to follow up. So their information will get transferred over. There's an interface between CalHears and the SAWS systems, but it's not right then to a completed application. So when they check that box, it is just a referral for a county worker to follow back up with them. But what we're working on now is to make it an immediate process where, while they're there in front of us engaged, we get them to complete that application.
Okay. Well, I mean, this is definitely encouraging. No doubt about that. I mean, obviously, the ultimate goal is one application, determine eligibility for everything across the board that may be available to a recipient.
Yes.
But I'm delighted to hear that you've gotten this far, and hopefully it won't be too long before you can get to the goalpost of the ultimate. So I look forward to hearing more. And one last, a lot of counties have a children's health initiative still, so they have health insurance for kids that may not qualify under other programs, either Medi-Cal or CHIP or Covered California. Is that integrated in any of the counties into this? Do you know?
I'm not positive about that.
Let us get back to you on that.
Okay.
Okay.
Okay. Thank you.
Any other
Good and
comments?
good work.
Yeah, very good work. Thank you very much. Thank you. We have some proposals under CalFresh, and we'll have those individuals come forward. You have 3 proposals, one on state emergency food assistance by Sue Sigler, lifting the lifetime ban on access to CalFresh by Jessica Bartholomew, and Bartholow, and CalFresh Administrative Match Waiver by Frank Mecca. So we'll have you come forward. Thank you. So we have 3 proposals under CalFresh. We'll start with State Emergency Food Assistance, Sue Sigler. You'll each have 4 minutes to present your proposal.
Good afternoon, Chairwoman Weber and subcommittee members, and thank you for this opportunity to address the need to better serve people who are hungry in California. California Association of Food Banks represents 42 food banks, a number of whom are represented in the room today, from every part of the state in service to our mission to build a well-nourished California. We are far from attaining that goal today because currently 6.5 million Californians struggle to put adequate food on the table. 1 in every 6 adults in California and 1 in every 4 children are classified as food insecure, meaning that their household regularly does not have the resources to procure adequate food. These 6.5 million people, or well over 18% of our population, have to make critical choices every day, often between food and rent, or between food and medicine, or between food and keeping the lights on. As a result, we see many people who skip meals so their children can eat or limit themselves to 2 or even only 1 meal per day, or find themselves in a constant juggling act just to be able to pay the bills and still get enough to eat. Many of these people will turn to food banks for assistance, and we're proud to provide hundreds of millions of pounds in emergency food assistance each year, the bulk of which is paid for by private dollars that food banks raise. California food banks lead the country in ensuring that the food provided is nutrient dense, but like a low-income householder, we only have so many resources as well. During the course of the most recent economic recession, our country saw the highest level of hunger and need for food relief since the Great Depression. And on average during that time, food banks saw a 30 to 50% increase in demand for food assistance. But sadly, we didn't have a 50% increase in our resources, and food banks were forced to cope in other ways, sometimes reducing the frequency that a family could receive food, but more often it meant reducing the number of items in each food bag in order to spread inadequate resources more broadly in a community. In short, they often served more people by providing each person with less food. Today, while our lines have stopped growing, they have not yet begun to shrink, and the demand for food assistance and the number of people who are hungry remains at a historically high level. We are all familiar with the dynamics of a recovery whereby California's unemployment rate remains above the national average, and whereby many people have returned to jobs that don't provide adequate hours or the rate of earnings they had achieved prior to the economic crisis. Last year, food banks were extremely grateful to be the beneficiary of $1 million in first-time funding for the State Emergency Food Assistance Program through the generosity of the Speaker. This was the first time that the state of California has invested in providing emergency food to its citizens, and that investment translated into 15 cents for each hungry person in California. Allow me for a moment to compare California's investment with other states. Pennsylvania invests $9.07 per hungry person. New York provides $10.51, and Massachusetts provides over $16 per hungry person in their state. Even Washington State, which boasts a 100% food stamp participation rate, still invests $4.63 per hungry person in food relief for that state. I would also mention that as a Californian, I'm proud of the work that has been done to implement the Affordable Care Act, and delighted that many low-income Californians now have access to health care. We have to also understand that food is medicine. Low-income people struggle with high rates of preventable diseases that could be positively impact impacted by having access to adequate nutrition. Our policy can and must be to care for people before they develop preventable diet-related diseases. Food banks have the infrastructure to ensure that additional food is distributed quickly and efficiently, and food banks are able to purchase food at far below market rate, generating a very high return on investment. I know that there have been some questions about the need for additional funding, given the $23 million for food relief that was contained in the governor's package, and I want to underscore that that relief is separate and apart from anything that's needed for the general population. Food banks who are accessing that relief to serve drought-impacted people are required to ensure that they are certifying that those people are drought impacted and served with drought funds, but those drought funds are not available to serve the general population. I request favorable consideration of the proposal before you to provide $5 million for emergency food purchases by food banks through the State Emergency Food Assistance Program, so that working together we can begin to ensure that those 6.5 million Californians never have to go hungry. Thank you for your attention.
Thank you. Okay. Jessica?
Thank you, Chairwoman Weber and members of the committee. Jessica Bartholow with the Western Center on Law and Poverty, here to ask for your support for a policy to remove California's optional lifetime ban on CalFresh and CalWorks for Californians with prior drug-related felony convictions. California turns away millions of dollars every year that could be used to fight hunger here in California. These are federal dollars. When we turn them away, they stay in D.C., where they don't help end hunger here. We're one of very few states that do this. In fact, 38 states in the country have no ban on the food stamp benefits, or CalFresh, SNAP, as they're called nationally, for people with prior drug felony convictions. A report by the Reentry Policy Council of the state governments, which is a bipartisan think tank, has said that access to public benefits and job supports is one of the best things we can do to reduce recidivism for people with prior drug felony convictions. And not only that, academic research shows that especially for women-led households, access to basic needs assistance like cash aid and food assistance can reduce the likelihood of recidivism by 83%. Research done by the Public Policy Institute of California found that most of the households denied aid here in California, where the adult has denied their portion of aid, contain children. They do still receive assistance, but they receive less assistance, that household, not because there are fewer people who need to eat. Human beings need to eat, and they all live with less income in the household to do that. So what else do we miss out in California when we deny low-income Californians federal food assistance? We also miss out on 50-50 match funding for employment and training. Texas and New York, they know how to use federal funding for employment and training, and they use it to help employment and training programs for people re-entering the community. Again, an important piece of reducing recidivism and reducing crime in low-income communities. So how much does this cost? In California, last year, the Assembly Appropriations estimated that about $3 million new federal dollars could be brought to California with a very small investment of $250 million administrative dollars. Only half of those coming from the general fund. So again, we could draw down $3 million new in anti-hunger federal benefits with a small investment of $125 million general fund dollars. You have before you a letter from over 100 organizations here in California.
May I say that at this time of day, this is far preferable to 100 people in line.
Great.
but it delivers the message very effectively.
Great. You have a letter before you. Again, it's all the people here in the hearing today and many more out there. We know the California Welfare Directors Association has been side by side with anti-hunger advocates, the California Association of Food Banks, Western Center on Law and Poverty, for years fighting for this money to come back in. Not only will it reduce hunger, it'll reduce recidivism, reduce crime, reduce prison size, and it's federal funds. So we ask for your support and look forward to seeing it in your budget.
Well, it's a very impressive coalition.
Thank you.
I'm not sure I've seen one with that many organizations on a letter.
It's hard to put that many logos on one letter.
Well, thank you very much. We will now go to the CalFresh administrative match waiver phase-out. Mr. Mecca, once again.
Thank you, Mr. Chair. Frank Mecca, Executive Director of CWDA, and I'm pleased to bring you a proposal that does not require that you add any general fund above what the governor has proposed in the January budget. So from a scoring standpoint, the admin match waiver issue does not create a general fund exposure above what the governor provided in January. And essentially, the match waiver allows counties to draw down state and federal administrative funds without putting up what otherwise would have been a marginal match of county dollars, provided counties meet their statutorily required CalWORKS and CalFresh MOE. It was enacted in 2010-11 for 2 years, and it was extended through 2013-14. Essentially, the decline in the economy and the rapid growth in the receipt of CalFresh benefits created a double whammy for counties from our ability to match our administrative allocations. The caseload skyrocketed, and our capacity to put up local dollars to match the money that the state and federal governments were putting on the table was substantially constrained. And leaving those dollars on the table would have compromised our ability to do outreach, to keep error rates low, to process applications on a timely basis. So the legislature and the governor were sort of gracious and supportive of our effort to implement the match waiver. As of right now, the match waiver, absent a change in law, would expire, and it would create basically a cliff effect for counties. The 33 counties were able to spend about $70 million in state and federal funding in the CalFresh program that they otherwise would not have been able to access. So what we're proposing is a 5-year phase-out of the match waiver that would allow counties to planfully, over time, increase our effort to reduce the reliance on the match waiver that you've otherwise provided. We developed a methodology or a rationale for why 5 years. Essentially, it's the point where we believe we'll have reached steady state. CalFresh caseloads are going to continue to climb, and if the horizontal integration efforts that we're all sure Mr. Dondra is going to make happen, we will continue to have some substantial increase in CalFresh even as the economy improves. And so as we look at a reasonable reduction in the normal rate of growth, and we look at the impact that we expect that the Affordable Care Act would have, and we sort of plot that all out, we see a steady state at about 5 years from now. And so we would urge your support and the administration's support for a sort of planful phase out of the match waiver so that we're not in a position of having to disinvest dramatically in our programs and stop doing outreach, compromise our timeliness and our program integrity. Thank you.
Okay. Thank you very much. Any comments from the Department of Social Services?
At this point, Senator, I think we should defer to Finance.
Okay. Any comment from Finance?
Chris Cook, Department of Finance. I'd just like to echo my colleague's earlier comment, which is notwithstanding the merits of the program, the governor's budget reflects the administration's current priorities, and we caution funding ongoing costs on uncertainty of the revenues, and are focused on paying down current debt obligations and long-term liabilities.
Well, without accepting those discussions with regards to any of the rest of them, on the second item, lifting the lifetime ban, isn't that primarily federal dollars that we're talking about here?
With regards to CalFresh,
Yeah.
yes,
Okay,
but
so I just wanted to differentiate that one in the sense that there's the overall budget rationale of being careful and not spending money that we don't have would apply less when the federal was predominantly federal dollars.
That's correct. The actual benefits would be federal dollars, but there would be with that additional administrative costs.
Additionally, if I could just note, Senator.
Yes, please.
As it's phrased here, it's also a CalWORKS exposure that would have some general fund impact that we have to run the estimates on.
I would like to also just point out that the state of California is liable for imprisoning people who are unsuccessful in reentering the community. And in the appropriations analysis in the Senate last year, The appropriations pointed out that for every 200 people, just 200 people, that the state of California would prevent from going back to prison because they had no food and then had to recidivate in order to feed themselves, we would reduce state general fund liability by $2 million and local liability for the local prisons or local jails by $7.3 million. So penny wise, pound foolish.
Well, on top of that, and maybe this is what Mr. Mecca is about to say, but I remember some years ago, and this is, I occasionally get around to paying a real compliment to the LAO, and we had a proposal by Governor Schwarzenegger to reduce what was then food stamps, CalFresh, in order to save on the administrative side, and it was an analysis clearly showed that the effect on low-income people having to spend more money on food instead of taxable sales was going to more than offset the budget benefit from the cut. So that was a very brilliant work of analysis. I don't know if that analyst is in the audience, but if they are, congratulations. I can't remember who it was. Oh, well, that was a bright moment for the LAO, quite frankly.
Mr. Chairman,
Speaking for myself here.
Mr. Chairman, if I could, CWDA is co-sponsoring the bill and CSAC is in support, and I want to be clear. Our interest in this bill is about the success of corrections realignment. So when we talk about evaluating ideas on the table in light of the governor's priorities or the legislature's priorities, it seems pretty clear to us that the success of corrections realignment is a priority for all of us. And it's hard to ask, my members participate in the local planning groups to help make corrections realignment work. And we have sheriffs and probation chiefs and others coming to us and saying, what can you do to help? We've got people that we need to help get jobs. We have people that we need to stabilize their housing situation so that they can take advantage of treatment, so that they can successfully reenter without recidivating. And to turn away funding that we can use to help make that a success seems to undermine the goals of the corrections realignment proposal that's the governor and the legislature's priorities. So for counties, you want us to make it work, and we want to make it work too. And this would be a tool that would help. And that's why we support it.
And I think this relates back to Mr. Dondro's discussion of the whole person and all the different elements of stabilizing somebody's life, and certainly in the context of realignment and trying to help people succeed and not going back to prison. That's even what he's talked about is even more true, I think. So, okay, LAO, any comment now that I've, talked about the brilliance of legislative analysts. I don't always talk about the brilliance of the LAO. But
I just, with respect to the county match waiver proposal, I just wanted to kind of add our perspective just in thinking about what the budgetary impacts are of extending or not extending the waiver. Essentially, the issue is whether counties would be able, in the budget year, to meet their full match amount. And it's difficult for us at this point to know exactly how much under the match counties would be given their individual circumstances. But supposing they were about 5% under, that would be $15 million or so of less spending on the part of counties. If the match waiver is in effect, that results in a reduction in total administrative spending of about $30 million. If the match waiver is done away with, as is provided for in current law, the reduction in total funding for the program would be about $100 million. So it's a question of what do we want? What does the legislature see as the appropriate amount of administrative funding if counties are unable to make their full match?
And one would imagine it's your intent that we actually spend the money that you make available for us to administer the program. So to not extend the match waiver if you agree that it's likely to result in underspending would suggest that you didn't want us to spend the money in the first place, which would make it odd that you would appropriate it. So we're taking it on faith that it's the intent of the governor and the legislature that by appropriating the money, you would like us to use it to the benefit of the program. And we are telling you, the LAO is correct, that it's going to be a struggle for some counties to continue to expend those funds if they have to make up all of that local match that because of the match waiver we have not been able to, and you have not required us to put on the table.
Okay, thank you. Any public comments? Yes, I'm sorry, Mr. Dickinson.
To this point, I mean, my understanding is
you can come on forward.
If the match waiver goes away, that that would cost Sacramento County $3.5 million out of their general fund, and it's not exactly money that they've got lying around ready to plug into this gap, and would also cost the county $12.5 million in federal money. Mm-hmm. So again, we're back to is that wise fiscal policy coupled with our programmatic objectives?
And what we're asking for is to give us some time to build up our local match capacity so that we can, over time, with planning, get to where we all want to be, which is a full county effort.
Okay. Thank you, and we'll go to public testimony. And we're back, I think, with a slightly shorter line than earlier, partly thanks to this. We'll go back to the 1-minute rule. So.
Okay, thank you. My name is Kevin Asley. I'm Coalition California Welfare Rights Organizations, and we support all 3 proposals. Thank you.
Thank you very much. Next witness.
Hi, Tia Orr on behalf of the Service Employees International Union. We represent the county staff in the CalWorks program and CalFresh program, and we represent all 3.
Thank you. Next witness.
Hi, Farrah McDade-Ting with the California State Association of Counties, in strong support of the second and third proposals, especially the match waiver phase out. We think it's a measured, appropriate plan to allow counties to get used to this reduction in match funding. So we strongly support that. And then on the allowing drug felons to access CalFresh and CalWorks benefits, CSAC as an organization supports this strongly. Our Administration of Justice Policy Committee, as well as our Health and Human Services Policy Committee, support this changing this. We think especially having access to the employment services under CalWorks would be a huge help with AB 109, criminal justice realignment issues. And I would say that if we didn't have that checkbox, are you a drug felon on the application, it would streamline it further for Mr. Jandro's efforts. And again, I just wanted to note CSAC's strong support of both of those items.
Thank you very much. Next witness.
Rebecca Gonzalez, National Association of Social Workers, California chapter, in support of all 3, but especially the first 2.
Thank you. Next witness.
Yes, Mr. Chair, Julian DeVos with Urban Counties Caucus in support of the phase out of the waiver. We believe counties do need more time, like Mr. Mecca indicated. Also, we also are in support of lifting the ban on the drug felons for realignment reasons for AB 109. So give us additional tools to help our counties provide the programs and services that are needed to these offenders so that we don't reduce recidivism and get them back in the community and help them pay taxes and help us all in the state. Thank you.
Thank you very much. Next witness.
Mr. Chair, Member Martha Guerrero, representing the Los Angeles County Board of Supervisors, and also in strong support. This is a priority for Los Angeles County for the CalFresh administrative match waiver phase out, specifically for the reasons that Mr. Mecca has pointed out. Thank you.
Thank you. Next witness.